Greetings, everyone, and a warm welcome. In this video lecture, I will be discuss the cognitive behavioral therapy Albert Ellis rational emotive behavior therapy and humanistic person-centered counseling Carl Rogers. Let us try to understand Albert Ellis rational emotive behavior therapy. Cognitive behavioral therapy (CBT) is a widely practiced and evidence-based approach to counseling that focuses on the connections between thoughts, feelings, and behaviors. One prominent form of CBT is rational emotive behavior therapy, developed by psychologist Albert Ellis. Rational emotive behavior therapy emphasizes identifying and challenging irrational beliefs to promote rational thinking and healthier emotional and behavioral responses. Key principles of REBT. 1. ABC model. Ellis introduced the ABC model to explain the relationship between activating events, A. Beliefs, B. And emotional and behavioral consequences, C. According to REBT, it's not the event itself, A. that directly causes emotional responses, C. but rather the beliefs, B. individuals hold about the event. Example: if someone fails a test, A. the emotional response, C. is influenced by their beliefs, B. about the failure. If they believe they are a failure as a person, irrational belief, they may experience intense negative emotions. However, if they view the failure as a setback and an opportunity to learn, rational belief, their emotional response may be less severe. 2. Identifying irrational beliefs. REBT identifies specific irrational beliefs, often referred to as musts or shoulds. Ellis proposed that individuals often hold unrealistic and irrational beliefs about themselves, others, and the world, contributing to emotional distress. Example: an individual might hold an irrational belief that they must always be approved of by everyone. When faced with disapproval, they may experience intense anxiety or depression. REBT aims to challenge and change such irrational beliefs. 3. Disputing and changing irrational beliefs. Once irrational beliefs are identified, REBT involves disputing and challenging these beliefs. This process aims to help individuals recognize the irrationality of their thoughts and replace them with more rational and constructive beliefs. Example: if someone believes they must be perfect to be worthwhile, a counselor using REBT might challenge this belief by asking for evidence supporting the idea that imperfection equals worthlessness. The goal is to replace the irrational belief with a more rational one, such as accepting oneself despite imperfections. 4. Developing rational beliefs. REBT encourages the development of rational beliefs that are more adaptive and conducive to emotional well-being. This involves fostering a realistic and flexible mindset. Example: instead of believing that one must always succeed, a person can adopt a more rational belief that acknowledges the possibility of failure and views it as a natural part of the human experience. 5. Homework assignments and behavioral techniques. REBT often includes homework assignments and behavioral techniques to reinforce cognitive changes. Individuals are encouraged to practice new ways of thinking and behaving in real-life situations. Example: someone with social anxiety may be assigned the homework of engaging in small social interactions and challenging negative thoughts that arise during these interactions. Application of rational emotive behavior therapy in counseling. 1. Anxiety disorders. REBT is effective in treating various anxiety disorders, including generalized anxiety disorder, social anxiety, and specific phobias. By challenging irrational beliefs about feared situations, individuals can learn to manage and reduce anxiety. 2. Depression. REBT helps individuals with depression identify and dispute negative and irrational beliefs contributing to their depressive feelings. It focuses on changing thought patterns that contribute to a pessimistic outlook. 3. Anger management. Individuals struggling with anger issues often hold irrational beliefs about fairness, justice, and the behavior of others. REBT helps individuals recognize and dispute these beliefs, leading to more constructive ways of managing anger. 4. Stress management. REBT provides tools for managing stress by challenging irrational beliefs related to the inevitability of stressors and individuals' abilities to cope. It encourages the development of more adaptive coping strategies. 5. Self-esteem issues. Individuals with low self-esteem may hold irrational beliefs about their worth and capabilities. REBT helps challenge and change these beliefs, fostering a more positive and realistic self-concept. Let me now discuss the Humanistic, Person-Centered Counseling by Carl Rogers. Humanistic, person-centered counseling is a human-centered approach to psychotherapy developed by psychologist Carl Rogers. It is grounded in the belief that individuals have an innate capacity for personal growth and self-actualization. Person-centered therapy emphasizes creating a supportive and empathetic therapeutic relationship wherein clients feel understood, accepted, and encouraged to explore their feelings and experiences. Key principles of person-centered counseling. 1. Unconditional positive regard. Central to person-centered counseling is the concept of unconditional positive regard. This involves the counselor offering non-judgmental acceptance and support to the client, irrespective of their thoughts, feelings, or behaviors. Example: if a client expresses feelings of guilt or shame, the person-centered counselor would convey empathy and understanding without condemning or criticizing the client. 2. Empathy. Empathy is a cornerstone of person-centered therapy. Counselors strive to understand the client's subjective experience, seeing the world from their perspective. This empathetic understanding fosters a strong therapeutic alliance. Example: if a client shares a challenging experience, the counselor might respond with empathetic statements like, "It sounds like that was a really difficult situation for you." 3. Genuineness. Congruence or genuineness involves the counselor being authentic and transparent in their interactions with the client. The counselor openly shares their thoughts and feelings while remaining focused on the client's experience. Example: instead of adopting a distant or overly professional demeanor, the person-centered counselor might share their genuine reactions to the client's disclosures in a supportive and authentic manner. 4. Client-centered focus. Person-centered therapy places a strong emphasis on the client's perspective, experiences, and autonomy. The client is seen as the expert on their own life, and the counselor facilitates self-exploration and self-discovery. Example: instead of directing the counseling process, the counselor encourages the client to explore their thoughts and emotions and to set the agenda for the sessions. Application of person-centered counseling. 1. Personal growth and self-exploration. Person-centered counseling is well-suited for individuals seeking personal growth and self-exploration. It provides a supportive environment for clients to reflect on their experiences and discover their inner resources. 2. Relationship issues. The approach is effective in addressing relationship challenges. By fostering open communication and understanding, person-centered therapy can help individuals explore and navigate complex interpersonal dynamics. 3. Anxiety and stress. Person-centered counseling assists clients in exploring and understanding their feelings of anxiety and stress. The empathetic and non-judgmental environment encourages clients to express and process these emotions. 4. Identity and self-esteem issues. Individuals struggling with issues related to identity and self-esteem can benefit from person-centered therapy. The unconditional positive regard and empathetic atmosphere support clients in developing a more positive self-concept. 5. Trauma and emotional healing. For individuals who have experienced trauma, person-centered therapy offers a safe space for processing emotions and gradually moving toward healing. The counselor provides support without pushing the client to disclose more than they are comfortable with. Thank you, everyone. If you're passionate about education and teacher training, consider subscribing to my YouTube channel Education and Teacher Education at Shokeen Bilal.